Hi, what's up, guys? Welcome back to another episode on the show Behind the Scenes in Health with Dr. Ron. And on today's episode, I'll be talking about who a safe doctor is. It's a recurring question. Who is a safe doctor actually? And over the timeline on X, formerly Twitter, people arguing who is safe, who is not safe. And having practice as a clinician in Nigeria, that conversation, it's a very vital one that should be had. So I'll be talking through the points about who is a safe doctor and how you can recognize a safe doctor, right? So if that's what you're interested in, if you like this topic, then stick around to the end of this video. If you're not a healthcare professional, yes, you should actually watch this video to the end so that you know who a safe doctor and you can identify who a safe doctor is, right? Hi guys, if you're new here, my name is Ronald and I'm the anchor on this podcast, on this channel. I talk about healthcare, health tech, I talk about alternative careers, interesting stuff. So just pause this video, subscribe to the channel, then keep watching, right? So let's get into the conversation. Who is a safe doctor? There are so many qualities that define a safe doctor, which I think we need to become very conversant with, especially in our settings, right? For example, if you tell a patient in Nigeria that you don't know something, then typically the assumption is this one no go school or he knows be anything, meaning that you really don't know what you're doing, or I don't know how they even see it. Or if you say, let me take a second to check the drug formulary or the BNF or the MDEX, it looks as if this guy probably didn't go to school or doesn't know what he's doing. Meanwhile, that is one of the qualities of a safe doctor. So I'll quickly talk through some of those points, and you tell me which one you've encountered in your doctor in the comment section. Let's see how conversant a lot of us are with who a safe doctor is. So by way of definition, a safe doctor is actually a healthcare professional who prioritizes well-being of the patient, follows established protocols and guidelines, and maintains a deep commitment to upholding and providing high quality and ethical care. That's a very super definition, right? I didn't write that anyway. So that's what a safe doctor is. And there are different points or criteria or attributes of a safe doctor, which I'll quickly go through. So number one, top of the list in no particular order, is effective communication. Now, a safe doctor engages you in clear, effective communication. They tell you what your illness is. They tell you, or basically what the problem is, what the outcomes are looking like, what the cause is, what investigations you're going to do. And when your test results come out, they take time to explain your test results. And when they give you medications, they explain to you what those medications are going to do for you, how they work, and the potential side effects that you might encounter, right? So they basically carry you all along. If you're going for surgery, they talk about the risk, they talk about the possible complication, even for routine or illnesses. It doesn't have to be surgery, but they take you the whole end to end, carrying you along in your care. Now, some people might argue, yes, in some places there is no time for people to discuss all of that, really, but I guess that's conversation for another day. But basically, they engage in effective communication, and most times when you leave the consulting room, you're happier than you came in because you're more informed about what's going on. And the truth is, patients adhere more when they actually understand what is going on with them, the outcomes, and why they need to take certain actions or take some certain medications, right? So effective communication is one. Next one is adherence to safety protocols. You're looking at people who adhere to guidelines, people adhere to standards, hygiene standards, because they want to minimize harm to you, the patient, right? You don't want people who do things because they think it works or do it their own way, really. So people who follow established guidelines that have been tried and tested globally, right? So a safe doctor doesn't want to harm you, so he usually adheres to safety protocols. The next one is ethical practice. Now there are a lot of ethics that bind the practice we do, things around patient privacy, things around confidentiality. In fact, the oath we take, I mean, you need to demonstrate the highest level of integrity when you're talking to patients, when you're interacting, even with colleagues, really, and the entire healthcare ecosystem. So your doctor wouldn't tell whatever or share your information or your illness with just anybody. I mean, whatever you tell your doctor in the consulting room stays with the doctor. I mean, it's not something that goes out there. So that's him or she, sticking to the highest ethics of the practice, really. Or those who are on social media going to talk about their patients on social media, those ones, they are not sticking to the ethics, and you wouldn't call them the safe doctor. I mean, how would you feel if after you left your office, your doctor's office, and maybe 2-3 hours later you're seeing your story on the timeline? It doesn't make any sense. So a safe doctor upholds the highest standards of ethical practice. Now the next point is continuous learning. A safe doctor engages in continuous learning, understanding that he or she needs to constantly stay updated because medicine is practically changing every minute. I mean, there are latest advances coming out, there are evidence-based practices being dished out per second. So a safe doctor tries to keep up to date with all of those trends, right? And it's really because you understand your limitations as a doctor. Nobody knows it all, and I think this is a point I really want a lot of patients to understand. No doctor is a repository of knowledge, right? I mean, there's a limit to what people know, and any doctor that tells you, look, he's not sure about this, he probably wants to consult with his seniors or with his consultants, that doctor is very safe. So you as a clinician recognizing the limits of your own knowledge and moving to the next step, that actually makes you a doctor, and you should be happy if your doctor tells you that. It doesn't mean he doesn't know anything. It's probably a GP. He sees you and he thinks, okay, you probably need to see the specialist, maybe the urologist or the neurologist, and he refers you. So it doesn't mean he thinks that is the best person that is well equipped to handle your case. So you don't want somebody who is not a specialist in neurology, tampering with you, in quote. So a safe doctor engages in continuous learning and trying to be up to speed, right? Then is always transparent and accountable. That's another quality or hallmark of a safe doctor. Transparency and accountability. They address issues as they come on. They'll take responsibility for their mistakes or errors, and put plans in place to make sure those things don't happen again. Then another quality is a safe doctor is they value teamwork and collaboration. No doctor works in isolation. You must work with your colleagues, you must work with the nurses, you must work with the pharmacists, the med lab scientists, technicians, optometrists. Everybody in the healthcare ecosystem is very important. So a good doctor, a safe doctor, values teamwork and collaboration, because that's the only way you can deliver effective patient care, by working with other members of the healthcare team. So anybody who doesn't like to work as a team member, then potentially might not be safe. Then the last point, but not the least, he demonstrates a lot of empathy and compassion, right? They understand the emotional and psychological needs of persons. You're talking to a person, you're able to empathize with them, understand what they're going through, and be able to reassure them that yes, you're going to do your best to help whatever situation they are in. And most times it's not really all about the drugs you give. Sometimes just the way your doctor talks to you really does a lot of magic. He understands you, he takes his time to listen to you and all of that. I don't know, I'm just talking from a patient perspective. Sometimes when I go to the hospital, I too see doctors too, and the way they talk to you, and most times I don't even say I'm a doctor anyway, so I just go as a normal patient. And so some of them are really cool, and they take time, talk to you, explain to you, and you really feel at home, even if it's a bad thing really. But the way they talk to you and package everything, you get to see it's not really that serious. So that's the empathy and compassion we're talking about. So anytime you're probably thinking who is a safe doctor, then you should think about these qualities I've listed about a safe doctor. You can tell me in the comment section what your favorite quality is. Drop them down there. I'll be reading and commenting. And yeah, that's it from me on today's episode. And until I come your way next episode, I remain your host, Dr. Ron. And like I usually say, stay safe and bye for now. Cheers.